I chose GSK because, first of all, I love the feeling that I can provide help to people. So healthcare is, I love it the most. And GSK is definitely one of the most respected company in this area.
I chose GSK because it's an industry-leading organisation, but in an industry that strives to impossible not to take pride in that.
I chose the commercial spree program because it allowed me to rapidly go around many different parts, different functions, different cultures, and I think that's a great way to meet the heart of GSK.
I think Esprit program is one of the most exciting and also very stretching program I've never seen in my career path.
So I chose the Esprit program at GSK because it offered me the flexibility to really guide my career within the context of some informal structure that allows me to really develop myself and be where I want to be in 4 years' time.
Coming out of an MBA, a candidate looks for truly global opportunities, and this is a truly global program.
GSK has developed me by setting me tough and demanding challenges, but at the same rate providing me with the support and training I need to carry out those tasks.
GSK in one word, amazing.
Fun and challenging environment.
GSK is the best.
The controversy surrounding Seroxat hasn't stopped it becoming the most profitable drug that GlaxoSmithKline has ever made. Just 6 years after launch, it became the company's first billion-dollar product. A triumph, some believe, of marketing over science.
For a time, even only in a matter of a few years, almost critical scepticism and objectivity were suspended in favour of the all-out rush to develop these new drugs and develop new markets.
Because there was such an excitement created about them?
Yes. As the head of GlaxoSmithKline once said, there's a lot of runway space out there for Seroxat. No, let's get the planes down.
Getting the planes down would, the company hoped, lead to their second billion. It applied to extend Seroxat's licence for the treatment of 5 more illnesses, some familiar, like obsessive-compulsive disorder, some not so familiar, like social phobia. Each of Glaxo's planes landed safely, with the regulators' full approval.
As more and more people have been prescribed Seroxat for a bewildering array of illnesses, another massive problem has emerged. A problem not as devastating as suicide, but one that affects a much larger number of patients. Many people on the drug say they've become hooked. Again, the regulator has failed to issue proper warnings, even though the evidence has been staring them in the face for years.
When Seroxat was first licensed, it was marketed with the regulator's approval as a safe, non-addictive drug. Back then, even Dr. Healy believed the hype.
When the drugs came out first, I had absolutely no concerns at all that there might be withdrawal problems with the pills. I think probably like almost all clinical psychiatrists here in the UK, I would have actively reassured people that they could go on these drugs without any risk of withdrawal at all. That this group of drugs was very, very different to drugs like Valium and Librium that had actually gone before them, to which people could get hooked.
That's what Sarah Venn was told. She was prescribed Seroxat for dizziness 7 years ago. But whenever she tries to come off it, the withdrawal symptoms just knock her sideways.
If I forget to take my pill for just one day, by the afternoon I'm starting to run a fever. Then my vision gets blurry and I see objects sort of moving around the room. I look like I'm having fits and spasms, and I get incredibly depressed, and I have never been depressed before. And it's ironic that I'm taking an antidepressant and it's made me suicidal on occasions.
In the late 1980s, before Seroxat was licensed, GlaxoSmithKline funded a clinical trial into the drug's effects on depressed patients. The man they asked to conduct it was Professor Peter Tyrer, a world expert on drug dependence. He came across a problem that would go on to affect millions of patients around the world. After 6 weeks on Seroxat, some of his patients were feeling better, but some of them were also hooked.
After the trial ended, they said, can we continue on these tablets because we feel we've got to have them because they seem to be so effective. But more concern to us was the fact that they were saying, well, I cannot tolerate the symptoms when I stop it.
As far as you were concerned then, were these people dependent on Seroxat?
They were showing, yes, signs of dependence.
And this was after
6 weeks.
Just 6 weeks on the drug?
Yes.
Some of the withdrawal effects were very disturbing.
They also felt more anxious. They felt this feeling of dysphoria, the feeling of being depressed, and in some cases entertaining suicidal thoughts.
That sounds pretty serious then, if people were thinking of suicide when they stopped.
Yes, it is serious, and in particular we were led to believe that these drugs were particularly effective against suicidal thoughts, and therefore having them at any stage during the course of treatment, even and on withdrawal, was a matter of great concern.
Professor Tyrer didn't investigate these problems any further at the time, but he did tell GlaxoSmithKline what he'd found. He says they weren't very interested.
It was very important to concentrate on the positive, so we didn't expect that they would rush in and investigate this problem as a matter of priority.
And as far as you're aware, they didn't investigate the problem?
No.
We asked GlaxoSmithKline if further studies were commissioned as a result of Professor Tyrer's findings on withdrawal. They didn't say. What they did tell us was the company reviewed reports of such symptoms in all its clinical trials as a matter of course. If the drug company didn't investigate it, what about the regulator? Since the early 90s, its yellow card scheme has been throwing out signals that many patients are hooked on Seroxat. The drug has attracted more yellow card complaints about withdrawal problems than any other prescription medicine. The MHRA says patients should have been well aware of the risks before they started taking it.